Hello, I'm Daniela. In today's video, I want to discuss a condition called chemo brain. This is something that affects chemo patients as well as cancer patients before, during, and after treatment. Now, I was diagnosed with lung cancer, and it came out of the blue. I didn't have symptoms. I went through surgery to have a lung removed, and then I went through chemotherapy. As you can see, my hair is coming back. But I wanted to discuss chemo brain because that's something that I had to deal with that I knew nothing about. I want to discuss how loved ones can help with this condition and then share some of my experiences. Now, the condition called chemo brain is where you have trouble concentrating and short-term memory effects, memory loss, for things where you might not remember what you did yesterday. These symptoms, this condition, chemo brain, can be tracked on an MRI, but treating it is a little more complicated. The result from chemo brain is disorganized thinking, confusion, memory loss, trouble concentrating, trouble learning, trouble holding a conversation and making decisions. And it affects us differently. Now, treatment involves dealing with the symptoms, not particularly the problem. There's no pill you can take to solve this problem. Some of the treatments can be done all by yourself with the help of a friend, or even just by yourself if you take the time and energy to work on them. Other things might require a medical professional, a doctor, or a therapist. So really find which one suits you, which will help you achieve your goals. If you'd like to work on some things alone, work on repetitive exercises, like puzzles. It can be a crossword puzzle, it can be a Sudoku, a number puzzle. Something that's repetitive and simple and no pressure. If you don't solve it, you don't solve it. But there is that challenge of trying to accomplish it. There are other coping strategies that you can use with short-term memory and concentration problems. Keeping lists of questions for the doctors, lists of symptoms that you have, lists of appointments you have coming up, and you can add to it and refer back to this to help you solve that problem. You can try a form of therapy, art therapy, or music therapy. It's just something that you do that works for you that helps you get some relief. You want to do your best to get sleep. Proper sleep really does help. It's not always the easiest thing when you're dealing with medical treatments or you're in pain, but it will help if you can achieve it. And then the last one is proper hydration and nutrition. It's very easy not to take that sip of water or thinking you'll take it in a moment and then hours pass by. And it's very easy to not eat during chemotherapy because your tastes change, you might feel nauseous, but you do need some type of nutrition. So that might be something to discuss with your doctor. Now, our loved ones and caregivers can help us with this by simply trying to keep life as simple as possible. Help us to make decisions, or don't ask us to make decisions over things that really at that moment in time aren't relevant. Choose the movie or what to have for dinner. It's nice to be able to ask somebody for their input, but at the same time, for a cancer patient and a chemotherapy patient, it's really nice not to have to make that decisions when you have a trusted loved one who'll help you. Accompany the cancer patient to medical appointments. A lot of times it's hard to remember everything that happened, and it's really nice to have a sounding board when you leave the appointment to discuss your treatment, your options, or just discuss what happened. And lastly, become just a listening ear. Or if your loved one who's dealing with cancer doesn't want to talk, well, then you talk. Share your experiences. Bring the outside world into them. But lastly, I wanted to share my experiences with chemo brain. Chemo brain was something I was not prepared for. I wasn't really sure that it existed or what it was. And then when I heard a little bit about it, I thought, well, that's not going to happen to me. Well, famous last words, it happened to me like a sledgehammer. I had a hard time retrieving words that I wanted to say. My short-term memory was terrible. I couldn't tell you what I did yesterday. I couldn't even tell you what I ate in the morning. I certainly couldn't tell you what day it was during my chemotherapy. So it's very helpful to have somebody to help guide me through that process. I had a very hard time saying the correct words even if I knew what they were. Proof of this is one video I did where I created a gel print and I used the word cobalt blue. Earlier in the day, I had been organizing my paints and I had the cobalt blue bottle. And when I filmed the video, I reached for that bottle, but instead of reaching for the cobalt, I got another color. It happened to be blue. And when I was narrating the video, my brain went to the cobalt blue. Well, I filmed the video, I recorded it, and I uploaded it, and people pointed out that blue was not cobalt. And they were right. And that's just one example of how my chemo brain came into play. It was a careless mistake. I didn't even realize it until somebody pointed it out. And if you would have asked me, I would have told you I had used cobalt blue because that's what I thought I had done. I also had a very hard time with time. Didn't realize how much time had passed. Sometimes I thought weeks had passed. It had been 2 days since my treatment. Sometimes I couldn't believe that I was so far into the treatments. Now each day, as I get further from my last treatment of chemotherapy, which happened weeks ago, each day gets better. My memory is starting to return and I can certainly feel it. One thing that was very helpful was my husband would point out very gently to me when I said the wrong word. And a lot of times I can remember having a conversation with him where I'd say, I said that? But that's not what I meant. And he understood that and he was pointing it out to me. And so I made a little more of an effort to understand what I was saying. And that's just the way it was. It wasn't great, wasn't bad, it just was. Now, chemo brain is a difficult subject to deal with. It's one that gets overlooked. It's not life-threatening. It's confusing, it's uncomfortable, and really when you're going through it, you don't have the energy to do much else. A lot of times the techniques for dealing with the symptoms, well, can't be done by somebody going through chemotherapy or cancer at the time. If they're in pain or if they're nauseous, you can't really eat when you're doing that. You can't really make a list if you're in pain and struggling just to survive. These things aren't going to happen for you. That was my experience for a time. Every day was different. A lot of days in the beginning were terrible, but I started to cope and come out of it. And I'm really appreciative for the help that I had to do so. So most people recover from chemo brain about a year after their treatment ends, sometime up to a year, but that isn't the case for everyone. So if you know somebody who's still suffering through these problems, be patient with them. In fact, that's my advice all around. If you're somebody suffering from chemo brain, be patient with yourself. If you're caring for somebody going through these symptoms, be patient with them and help them to get through it. Now I'd like to ask you, because so many of my viewers have shared their experiences with their cancer journeys. Have you experienced this phenomena of chemo brain? And how did it manifest for you? And if you're so kind, would you share techniques on how you overcame that? That would be most helpful for this community. I want to thank you for taking the time to watch this video. If you've enjoyed it, please give it a thumbs up and be sure to subscribe. Thanks for joining me today.